Good evening, everyone. Many thanks to the organizer for inviting me to this mindfulness conference. And the topic for today's presentation is Growing Old, How Mindfulness Can Help. But before I begin, I should have a disclaimer. So just to let everyone know is that I'm not an expert in mindfulness, but I'll try to practice it in any way that I can. I am a geriatrician looking after older adults, and I will try to deliver this talk to the best of my ability with whatever knowledge on mindfulness that I have. So I've divided the contents of my talk into 4 parts. Firstly, I'll be sharing on the physiological changes of aging. Next, I'll be introducing the concept of mindful sustainable aging. Then, I will share with everyone regards to how do we cope with aging through mindfulness principles. And finally, I will share with everyone also some reflections of geriatrician as I continue to get older with time. So the first part is the physiological changes of aging. So we all know that aging is inevitable in our life's journey. It is characterized by progressive degeneration of organ systems and tissues, and this includes the kidney, the liver, and also the heart. And it is influenced by many environmental factors, and such as diet, whatever that you eat or drink, exercise, exposure to microorganisms, like for instance, bacteria or viruses, pollutants in the environment, and also ionizing radiation. Aging is also determined by genetics. Because of all these factors, 2 people of the same age may actually differ in terms of their physical appearance and physiological state. So basically, there are 3 groups of changes that occur with advancing age. The first group is there are changes in the cellular homeostatic mechanisms, for example, the body temperature, the blood sugar level, blood pressure, and the body fluid composition. So homeostatic mechanisms is basically the mechanism to regulate our body and maintain it at a steady state. Another group of changes is the decrease in the organ mass, like for instance, the liver and the kidneys, and even the brain. And the last group of change is the decline in and the loss of the functional reserve of our body's systems. So this picture tells you the various body systems that is present. For instance, you have the neurological system, which represents how the brain and the nerves function, and also the cardiovascular system, which represents how the heart and the heart vessels function. I'll be expounding a little bit more on each system in the subsequent slides. So first of all is the neurological system. As we age, there's a reduction in the weight of the brain and even the size of the brain and also the cell count. So what this means is that there's altered response to whatever drugs that we give, especially sedatives, because there's increased sensitivity to these centrally depressant drugs. For example, if an older adult take in a cough mixture, they can be very sensitive to it and they can even fall asleep easily. There's also a reduction in the speed of nerve conduction as we age. That's why in terms of trying to process information, our processing speed also reduces as we get older. And there's also a reduction in the cerebral blood flow and also the oxygen consumption by the brain. And the implication is that there's increased risk for cerebrovascular accidents or what we call stroke with any associated vascular disease. Next, I will touch on the sensory system, basically the sight and hearing. So with age, there's increase in the lens opacities, and this increases the risk of getting cataracts as we get older. We also get into long-sightedness, hyperopia. There's also a decrease in the visual acuity, the distance at which we're able to see things, and color sensitivity, and even depth perception. What is the implication of all this? Older adults are also at risk for falls. So there's also degeneration of the bones in the middle ear, in which the medical term is called ossicles. And the purpose of these middle ear bones is to transmit sounds from the air. With this degeneration, older adults may get problems with their hearing. There's also loss of the nerve cells in the inner ear, or what we call the cochlea. And with that, there's also decrease in speech discrimination. For the cardiovascular system, as we get older, the cardiac output actually decreases after 30 years old at a rate of about 1% per year in normal subjects without cardiac disease. So when you compare an 80-year-old with a 20-year-old, their cardiac output is actually about half that of a younger counterpart. What does this mean? It means that with physical exercise or even any form of physical exertion, older adults tend to get breathless easily. There's also thickening or hardening of walls or arteries, or what we call atherosclerosis, that progressively occurs with aging. And hence, myocardial infarction, or what we call heart attack from coronary artery disease, increases dramatically with age. The heart muscle wall, or what we call the ventricle, also gets a bit stiff, and the heart relaxation actually decreases. So older adults are also at risk of congestive heart failure, where there's actually water in the lungs. For the respiratory system or the lung function, so there's increase in terms of the residual volume with age. And what it means is that the volume of air that actually remains in the lungs after you forcefully breathe out actually increases. There's also increased airway resistance and airway reactivity. There's also stiffer chest wall. That means the chest wall is less compliant as you breathe in and breathe out. So what does it mean? In the presence of any disease, basically where you have damages to the lung from, for example, smoking, this will actually accelerate the normal physiological decline. And you can actually have a lot of all these symptoms, like, for example, breathlessness, or what the medical term called is dyspnea. For the gut system or gastro-intestinal system, there's fewer taste buds and decrease in saliva flow. That's why our taste changes as we age. And there's also reduction in terms of the intestinal motility, and this leads to increased storage capacity of the intestine and longer stool transit time. That's why as we get older, perhaps we can get easily constipated, and some of the older adults actually need regular bowel clearance through the use of laxatives. There's also a decrease in the liver's ability to clear the toxins. That's why doctors sometimes have to consider the type and the dose of drugs that can be prescribed for our elderly patients. The reason is because some of these drugs are metabolized by the liver, or they are cleared by the liver. So for the renal or kidney system, above 30 years old, the kidney blood flow actually declines progressively, and this is at a rate of 10% per decade. So that's why your doctor may have to adjust some of the drugs when they actually prescribe to you, because these drugs are sometimes cleared by the kidneys. So an aging kidney actually has a reduced ability to dilute or even concentrate urine. And as we all know, older adults have a decreased thirst perception, and sometimes they just don't want to drink water, because even though when they are dehydrated, they just fail to increase their water intake. And there's also a delayed or even slowed response to changes in the sodium levels, and even a delayed or sluggish response to an acid load. So what this means is that they can get water retention easily, and also they are predisposed to having electrolyte imbalances. Some of the electrolytes include sodium, potassium, and calcium. So when an older adult is admitted to hospital, we will want to monitor their fluid status and even their electrolyte levels also. So in terms of the hormonal system, or what we call the endocrine system, for females, as they get older, there's also leading on to menopause, where there's estrogen deficiency, and the associated symptoms include hot flushes, increased mood swings, and also loss of libido. For males, there's low testosterone levels as you get older, and this is associated with decreased libido, muscle shrinking, osteoporosis, and possibly erectile dysfunction. Another important thing is also there's deterioration in the number and the function of insulin-producing cells. And as a result, there's impaired response to changes in the glucose concentration. For instance, if you get admitted to hospital and you find that an older adult sugar levels keeps rising or keeps having difficulty in trying to control them whenever they are ill. And when you have high glucose level, you can get extreme tiredness or even lethargy. And there's also a decrease in bone mass, where there's risk of osteoporosis and fractures with falls. Finally, in terms of the musculoskeletal system, there's loss of bone, cartilage, and collagen, and also a decrease in bone density. On top of that, you can also see that there's a reduction in terms of the size, the elasticity, and the strength of the muscle tissues. Why this is happening is because the muscle fibers actually get smaller in the diameter, and the muscle activity then becomes less efficient. That's why you require a lot more effort to accomplish a given task as you get older. So the implication of this is that there's increased tendency for falls, and also older adult at a high risk of functional decline after a short period of immobility. That's why when you have somebody, for example, who is quite frail, they get admitted to hospital. After 1 day of bed rest, they tend to have difficulty in trying to regain their strength, and it takes a period of maybe a few days or even a week to go for rehabilitation to go back to their premorbid functional level. Next, I will introduce the concept of mindful sustainable aging. So what exactly is mindful aging? So mindful aging is basically seeing aging in a way that doesn't deny the negatives of getting older. From what I've mentioned earlier, all these physiological changes of getting old actually have a lot of negativity. But then if we don't deny, if we don't deny it and we actually don't blow it out of proportion or even dwell on it, I think we can actually turn our mind to think to the benefits of aging rather than all these physiological changes of aging that is happening. And hereby is the concept of mindful sustainable aging. What it does is that it helps to promote healthy aging, and it serves like an approach to the facilitation of old age, where it places mindfulness practice and even mindfulness thought in a very central role. So it serves like a life-enhancing tool. It promotes a physical and mental fitness, also encourage active social interaction, and focuses our mind on the search for existential meaning. Apart from that, also in terms of self-discovery and finding peace in this phase of life. So it's a concept whereby it produces a kind of a positive approach where you try to see old age as an essential part of the human journey, and thus giving you this opportunity for finding spiritual or existential growth and even self-discovery. So before I could explore a little bit more on the mindful sustainable aging, let me explain the 4 psychosocial theories of aging and present to you first so that you're able to understand how mindful sustainable aging actually encompasses the 4 psychosocial theories of aging. So the first theory is called the activity theory. Then we have the disengagement theory, the successful aging theory, and finally, the zero transcendence theory. So what these 4 psychosocial theories of aging do is that it tries to explain to people what they can do to maintain a high quality of life when they get older without giving in to despair or depression or extreme inactivity as they get older. So these are the 4 theories of aging. First of all is the disengagement theory. What it does is to promote contemplation and reflection in older adults, as opposed to just artificially keeping yourself so busy with external activities and letting the time pass as you get older. Then we have the activity theory that actually recommends older adults to be active. That means they want to promote positive self-conception, thus leading to greater life satisfaction and higher morale. So self-conception is basically how you perceive yourself, your behavior, your unique characteristics, and your abilities. In layman's terms, it's about having a mental picture of who you are as a person. For successful aging theory, it describes successful aging as trying to minimize the risk of disease or disease-related disability, and also maintaining your cognitive and physical function, and also continue to have active engagement with life. And finally, the zero transcendence theory. This theory actually focuses on the inner reality and inner development. So what it's trying to promote is that aging enables one to actually mature from a primarily materialistic, rational perception of the world to actually defining oneself and also redefining the relationship to other people, as well as having this new existential outlook. It's more like a form of like spirituality. So this diagram actually tells you how mindful sustainable aging is able to encompass the need for activity, the need for disengagement, the need for gero-transcendence, inward turn, which also means the transformation characterized by new ways of understanding life, activity, and understanding yourself, and also fulfills the requirement of successful aging. So, with respect to the disengagement theory, actually mindfulness allows us to dwell in the being mode with acceptance. That means it allows us to cultivate the qualities like compassion, empathy, and forgiveness toward oneself and other people. And with respect to activity theory, regular mindfulness meditation and even things like more body scanning allow us to have this stimulation for the brain, thus making the older adult actually more mentally fit. And with respect to successful aging theory, mindful practice positively affects optimism, make us see things in a positive light, build up our resilience, and also engage in effective coping styles and even things like coping with stress, and also continue our social and community involvement. These are all correlates of successful aging. And finally, with respect to the gero-transcendence theory, mindfulness practice actually facilitates the shift from the outward to the inward life. What this means is that it makes room for solitude. It brings peace to our mind, and perhaps it encourages us the search for meaning and wisdom as we get older. So this integrated approach actually has many purposes. And the mindful sustainable aging helps us to perhaps manage the hazards of old age. For example, physical illness, cognitive decline, the fear of getting dementia as we get older, because we know that the risk of dementia increases as age increases, and even death itself. So what it does is that it helps to cultivate a mindful sense that is still vibrant, there's hope and meaning even as we get older. There's also a cultivation of our inner being, whereby we try to withdraw from the outer realm of just the doing mode and shift them into the being mode. And once we're able to do that, we are actually considered to be spiritual elders. And one of the hallmarks of spiritual elders is the ability to achieve generativity, which means the concern for people besides self and family members, and also the ability to achieve wisdom. So mindfulness actually involves the practice and development of these skills that actually facilitate and even cultivate generativity and wisdom. And what we want to do is to better the lives of older adults, and at the same time, enabling these older adults to make the most of what their lives have to offer. And essentially, in essence, it's a life-enhancing tool where mindfulness practice and thought actually plays a central role in their lives. Next, I'll go on to how do we cope with aging through mindfulness. So everybody knows that what the definition of mindfulness is basically paying attention in a particular way on purpose, in the present moment and non-judgmentally. And we know that old age has many challenges and even inconveniences. But I think that despite of all these challenges and inconveniences, growing old can be a highly productive state, highly rewarding, and even meaningful period of life. But it truly depends on how one approaches, confronts, or even engage in this phase of life. But I think that it is important for us to learn to use mindfulness later in life, because then it can actually help us cope in terms of the psychosocial crisis of old age that we may face and the struggle to actually find meaning in later life. So, using the 4-dimensional framework for mindfulness, I would like to share with everyone how mindfulness itself can help us think through how we can age mindfully and even cope with the aging process. So the first dimension is physical. So mindfulness helps us to focus on the body's moment-by-moment state of being, and also our routine bodily activities, like for instance, eating and walking. And through these various mindfulness techniques like body scanning, meditation, and yoga, it heightens our awareness of body's various states and also allow us to take better notice of any health problems that might arise. For instance, when you do body scanning, you start to realize that there are different parts of your body that may be painful, for example, your knee, or you start to realize that there are some lumps or bumps in your body, and that's when it will trigger you to seek medical help early and get the diagnosis early. And mindfulness training actually also provides the older adult perhaps with an excellent opportunity or even an excuse to exercise the body in a regulated manner. The second dimension is the mental dimension. So most of us know that mindfulness practice actually serves to stimulate and rejuvenate one's mental faculties. And some of the techniques like yoga, body scanning, and meditation can actually help in the regulation of various mental states. And mindfulness practice itself is of great importance when it comes to the management of stress, anxiety, and depression in old age. The third dimension is the social dimension. The goal of mindfulness training is, in fact, to increase the feelings of empathy and compassion, not only towards others, but also towards yourself. Oftentimes, we tend to forget a lot of compassion and kindness towards ourselves. And through these positive social feelings, it can allow us to enhance our sense of inner integrity and deepen our wisdoms. And in fact, mindfulness encourages social interaction and also involvement by engaging even the older adult in group activities that are enjoyable and challenging. And finally is the existential dimension. So for majority, the primary driver in our life is actually not the pursuit of power or enjoyment, but rather the search for meaning. And mindfulness actually allows us to reflect and contemplate about life. Although the search for meaning is important regardless of one's age, I think it is of crucial importance for those who are coming close to the terminus of life as we get older. So there are various mindfulness techniques that we can adopt and practice. And accompanying these techniques, there are a multitude of benefits ranging from physical health, cognitive health, and emotional health benefits. I'll give some examples. So the first example is breath focus. What it does is that it helps to lower our blood pressure, improve our sitting posture, improve clarity of the mind and attention, and it helps to increase our calmness and improve mood. So for instance, whenever I feel very upset or angry towards my junior, for instance, if they had done a certain mistake during ward rounds, I find that breath focus is very useful because it allows me to, not be so angry. My face will be very flushed, and it helps to make my red face actually lesser red so that it won't be too scary to the junior. And it lessens the anger that I feel so that any hurtful things that I'm about to say will not be said out to hurt my junior's feelings. The next is body scan. In the literature, it has been proven that body scan helps to heighten awareness of pain and thus seeking medical treatment early, and also increases awareness of the mind-body connection and also build discipline and patience. And for mindfulness meditation, it helps to enhance the immune system, lower the heart rate, improves memory retention, and also sleep quality, which perhaps is very useful for those who have insomnia, and it helps to reduce depression and anxiety. Other techniques like yoga, tai chi, and qigong may also be very useful because it helps to reduce the muscle tension and improve balance. And as we get older, we know that there's increased risk of falls, and thus through these techniques, it helps us to improve our balance. It also helps to improve the sleep and concentration and reduces depression and anxiety. And finally, for guided imagery, which is actually a form of relaxation technique that draws on your ability to visualize and daydream. What it has proven to be useful is that you find yourself being less bothered by the pain, enhances your pain tolerance, also disrupt the pattern of rumination. And we know that when our mind starts to ruminate, it can continue to ruminate till no end, and we get very tired just keeping on ruminating on the negative side of things. And also makes us less nervous or upset. And another way of coping with aging, I find, is to place mindfulness practice onto our daily lives and what we call informal everyday mindfulness. I think we can take almost any activity, like for instance, brushing our teeth, reading, eating a meal, or even taking a walk, and make it as mindful as possible. And the main key is actually to focus on the activity rather than to let our mind wander to other things. And how we can do that is actually to start with the activities of daily living, perhaps. For instance, things like, going to the toileting, while we are showering or bathing, when we are eating, when we are dressing, or when grooming ourselves, or even transferring from one position to the next. And then we can actually put mindfulness in the center of what we do daily. It need not be so elaborate. So this is the final part of my presentation. Basically, is the reflections of a geriatrician as I was preparing for this talk. So in my journey with mindfulness, I got to know Angie and had collaborated with her on mindfulness courses for me and some of my colleagues who care for geriatric patients. In 2018 Mindfulness Conference, I had given a talk on the effects of stress and mindfulness on health. And in the 2019 Mindfulness Conference, I presented on mindfulness and memory. And now, in 2020, I'm presenting on growing old, how mindfulness can help. So I find that it's very apt. I feel as though I'm growing old over the years as the Mindfulness Conference start embarking year after year. But I realized that with each mindfulness conference, I've gained a lot of wisdom and definitely a lot of knowledge. So I've always tried to fall back on the foundational attitudes of mindfulness that I've learned. And this will somehow guide me in how I lead my life on a daily basis and how I try to cope with the stress or relationship demands. And these foundational attitudes are kindness, loving kindness for yourself, and also kindness to other people or any living things. Non-judging, and we are always harsh on ourselves. We beat ourselves to death. So I think we should be less judging of ourselves and perhaps less judgmental of others and less judging of the situation that we are in. Next is to focus on what you can do. That means things that matter and things that you can control. That's where you can focus on and not focus on the negativity of things. Then you have acceptance. You need to accept certain things about yourself or accept certain things about others or accept the situation that is unfolding that is beyond your control. And finally is gratefulness. I think sometimes we don't express much gratitude, and even a simple thing as being able to wake up every morning is already a sense of gratefulness in itself, because not everybody is able to do so when you are unwell. So I think that through this foundational attitudes, in fact, I was thinking of some advices for the future older me so that I will be grounded in life. And I hope the subsequent slides that I'm mentioning do resonate with everyone and encourage reflection on everyone's part too. So the first advice to the older me is this: Dear Lina, work can be stressful and there are moments where you may want to give up in future. But not everyone has the opportunity to be in a profession of caring. You need to always feel grateful for the opportunity to serve the elderly and make a difference to their lives. Focus on moving forward and not dwell on the past mistakes that occurred at work. So this is what I want to advise the older me when I get older next time, and then I will look back again. And my next advice is that, you know, Lina, as a geriatrician, you will grow old eventually and be a geriatric patient yourself one day. So there's limited memory capacity, and you may not be able to remember everything that you read right now, but the knowledge that you have gained can actually be shared with others. It's perfectly fine not to have all the answers to everything. And it's also fine to admit that you don't know certain things because you don't have all the answers. But always be kind to others, especially your juniors at work, and invest in them through teaching, training, imparting of whatever knowledge that you have, and sharing of your experiences. Because one day, they will be the one looking after you in future. And my next advice is that, Lina, you know you will slow down physically as you get older. And you need to accept that everyone, including you, will grow old and may not be as physically strong or fit when you're younger. So what you need to do is actually to focus on residual ability and magnify these abilities rather than focus on the things that you cannot do or the disabilities. And do try to reduce any self-judgment, because we tend to beat ourselves so much when you cannot conduct certain tasks as efficiently as before when you are younger. And do be kind to yourself. And my last advice to the older me is that, Lina, relationships with people are important as your social circle gets smaller. And you know, as you get older, you try not to socialize as much as when you are younger, which is very true. So you need to invest time in your current relationships with your family, friends, and even colleagues. Always show empathy and compassion for your loved ones. And always build bridges and not burn them as you get older. So I hope these advices if you can try to twist some of the words, and perhaps I hope these advices promote some form of reflection in everyone, then I think it helps a lot. So this is my favorite slide. I think most of you may have seen this slide before. So before the conference, this is the baseline knowledge that you have about mindfulness and growing old. But I'm very sure the first 10 minutes of the talk, you're actually trying to absorb as much information as possible. But I am very sure at this point in time, most of you perhaps are just letting it go and may not remember what I've said, all those zero transcendent theory, all those activity theory. But I am also very certain at the end of the conference, at the end of the day, there's also an increase in the level of your baseline knowledge with regards to mindfulness and growing old. Thank you very much, and I hope that nobody's concussed after this lengthy presentation.